4 days after Juvederm, uneven and bumpy lips. Is this swelling or final result? I had one syringe of Juvederm injected last Thursday, 4 days ago. I had a lot of swelling, which has dissipated greatly. However, now I see that my top lip is very uneven. Is this something that will resolve as more swelling goes down, or should I go back to see my doctor? I do have a small scar on my upper lip, but I didn't think this would interfere with the fillers.
Thank you for your question. You've submitted several photos and described in your question that you had one syringe of Juvederm placed in your lips 4 days prior. And you certainly described very well in detail the concerns you have about unevenness in the upper lip, and you are conflicted about whether or not it's normal, whether it's swelling, whether you need to go see your doctor. You mentioned a small scar in the upper lip that may or may not be relevant to your concern. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and injectable fillers for lip enhancement is something I do in my practice every day. And I'm certainly very familiar with the product Juvederm. So I think that there was possibly an opportunity to communicate a little bit more with your doctor here, because it is really normal to expect variability with lips. Now, this doesn't necessarily mean that you won't need any further enhancement, but I explain to my patients that who want lip enhancement that there's a spectrum of controllability and degree of swelling when it comes to lips. And what I mean by that is, if someone comes in who wants to just accentuate the border of their lips, well, that degree of swelling is going to be different from someone who wants to accentuate the border and the actual pink part of their lips. So the more places you inject, the more likely that you're going to have some issues with some variability. What I explain also is that lips swell very, very easily. A little bit of trauma results in a lot of swelling. And when you are dealing with, especially with what it appears to be as a relatively new experience for you, is placement of all this volume and then your body's response to the trauma of the injection, as well as the material's integration with the soft tissue of the lips. So in my practice, I tell patients to come in and see me after 2 weeks. I think that 2 weeks is kind of like the ideal window of when we can actually tell if there is an indication for any type of modification, such as an enhancement. So I think that as long as you communicate with your doctor, certainly you should be able to go see your doctor if you want to have that concern taken care of. I always tell my patients is that we always have an open door policy and they can always reach me. And so even if there's a 2-week time frame, you can certainly come in, a patient can certainly come in anytime before that for me to take a look. You know, there's one thing about submitting photos and taking pictures with your phone and sending them in, and there's another thing when you're actually in front of the doctor and the doctor is able to examine you. Sometimes a little bit of massage can be of help to help you ride through the next couple of weeks. But that's really between you and your doctor. But so I think that we can at least reasonably conclude that understanding that if you're going to do injectables for your lips, you have to allow adequate amount of time, so you don't do an injectable before doing a very important presentation the next day. You allow the 2 weeks to transpire, and then you see your doctor about any asymmetries, irregularities, and things like that. I also explain to my patients is that when the material is integrated into the tissue, just the act of talking, smiling, moving, just the dynamic nature of lips and anywhere in the face where there's a lot of movement actually helps to shape the material. And so I think that the art of injectables and lips is very often doing the procedure in a way where you know as the physician that the appearance is where you want it to be at the time you do the injection, and then being prepared to deal with swelling. In many ways, it's comparable to a lot of different surgeries where what you see in the operating room can look good, but then a certain amount of swelling can occur, especially in the first week, where it can change the appearance from what it was in the operating room, but you have the confidence knowing that what you did in the operating room will eventually be the result that you see once swelling and healing has been completed. So I think you need to contact your doctor not only to get the reassurance, but possibly to just be seen so that you can really feel comfortable and confident. I think for people who try injectables for the first time, it can be unsettling. And when you feel like your lips are swollen, you're uncomfortable, I always tell, like I said, I always tell my patients we have an open door policy. You come in sooner, I can evaluate you, and we can take it from there. But most of the time, I'd say 99% of the time, the 2-week window is just right. So I hope that was helpful. I wish you the best of luck, and thank you for your question.